Good afternoon, Kahnawake, and welcome to another update from the Public Safety Commission. I got a lot of information to cover this afternoon, but I'll try to be as brief as I possibly can. We did have a Public Safety Commission meeting yesterday, and we did cover a lot of information that is very pertinent to the community as we continue to move through the recovery phase, of the pandemic. And a lot of times we talked about the criteria for us determining whether we are in alert level green, yellow, or red in the community. We talked about number of cases as being one of them, amongst ability to contact trace and many other factors. And I wanted to remind the community on some of those factors that we consider moving forward, and this again was discussed in detail yesterday with the commission. I know a lot of people focus on numbers and as the sole factor, but it is much more comprehensive than that. Certainly, the total number of active cases, is something that is very relevant when we're doing an assessment of what level of alert there is in the community. And we have to also assess whether there are individual cases or if they are linked in any way. Also, you have to look at the number of people in isolation. Vaccination rates in the community is always a factor. Vaccination rates amongst the certain age groups, again, is very appropriate. The ability to contact trace within 24 to 48 hours. Also, the testing abilities at the testing center in the community is also something that we have to consider. Hospital rates in hospitals around the community, especially those who Kahnawake frequent often. We want to make sure that we're aware of the status of their ERs, their hospital, and also ICU beds. So if people need the beds, we have to do our best to ensure that there's some that is available as best as we possibly can. Also, the total number of cases within Quebec and also in our region. We also consider economic factors of measures. We also can look at the level of compliance with what's in which the measures are being followed. There's also obviously political impacts in the community, social impacts, as well as identifying risks in the community, whether that be increase in risk or decrease in risks. We also try our best to identify those and factor that into decision making on level of alert and other decisions that need to be made moving forward. Like, for example, we all know the holiday season is approaching us. Today is American Thanksgiving. I know many Kahnawake celebrate American Thanksgiving as well. So we know there will be no more people gathering with family and friends and such, which is nothing wrong with that. It's just that we have to note that there is increased risk when people are indoors and more close contact. So it definitely is a greater risk. Cold weather, obviously people going indoors. More travel. The American border obviously just reopened officially a couple of weeks ago, so more and more people are traveling to the U.S. Rates in the U.S. are continuing to increase. Again, nothing wrong with travel, nothing wrong with getting back to a life as normal as possible, but we have to understand that there is still that level that exists to our community. So all these factors put together, we did take a snapshot, if you will, regarding where we are today in terms of our community. Overall, the situation in the community has remained stable. In the past 3 to 4 weeks, we have been, give or take, 5 cases, within the community. Currently, we are at 8 cases active within the community, and we do have 20 plus people who are currently in isolation. I'll touch on that a little bit more in a minute. Although there's cases, in the community. As long as they are manageable and things are relatively stable, we are in a relatively good place. But we have to remind ourselves that the virus is still amongst us, and there are still individuals, children, elders, and everybody for that matter has a level of risk that they have to be aware of. And the goal of public health and public safety is to take steps to remain stable, so that we stay stable as possible. 3 weeks ago today, we announced phase 5 of reopening for businesses primarily, and for reducing measures for some areas of gathering for clubs and for funerals and stuff of that nature, to open that up more again, to have more of a sense of normalcy. And that has rolled out well. But on the other side, we also got to keep track that as we speak today, the cases in Quebec and also the Montérégie region continue to rise gradually. We were at about 500 per day for a number of weeks, but in the past few weeks, they have been increasing to an average of 700 plus per day, including yesterday was over 800. This is not totally unexpected. Because things are continually evolving, more and more pre-pandemic activities are happening both inside the community as well as externally to the community. So it is expected to have some increase in cases. Again, nothing wrong with having those activities, but it does elevate the level of risk associated with our everyday lives. More travel to the U.S. also has a slight increase of risk. Because as you can watch the news, CNN and such, the cases in the States are also gradually on the increase. So again, more reason for us to be cautious, more reason for us to be more vigilant. We also have to take note that if you watch the news once again, across Europe, parts of Germany and Italy and Netherlands are experience what seems to be the beginning of a fifth wave in Europe, and they are contemplating lockdowns in many areas across Europe to try to curb the spread once again. We have to look at this just as a warning sign, because as we experienced in the previous waves, 2 to 3 months after what happens in Europe seems to work its way across the Atlantic and impacts North America. So we got to keep an eye on what's happening around the world, because again, yes, this is a global pandemic, and so knowing what's happening around there is again, gives us a warning sign. It's not to say that will directly impact us, but it's something to certainly keep our eye on as we move forward. So it's this, again, another reason for us to remain vigilant. As I mentioned, holiday season and cold weather, more indoor gatherings also increases the risk. But then as we speak today, with the current measures and restrictions in place, there are many businesses, I won't say all, but there are many businesses who are operating at near pre-pandemic conditions, capacity and such. So the economic recovery is on the way. It's not where it used to be, but it's certainly taken on the right track. And again, as we talk about recovery, we haven't achieved full openness as we speak pre-pandemic, but we're definitely on that path. Social considerations as well are important. More we want to try to open up social activities, people's ability to gather and enjoy pre-pandemic activities. Also supports the mental and social well-being of individuals in the community. So we want to be mindful of that. We also have to look at the politics of Kahnawake. Throughout the whole entire pandemic, we made decisions and continue to make decisions, not looking at necessarily the political impacts. We try to make our decisions based on science and based on health moving forward. But Kahnawake being Kahnawake, there are politics involved in many things that take place in our community. But we certainly want to minimize that as much as possible and not guide decisions. Welcome back, and I'm sorry for the interruption there. We had some technical difficulties. I'm not quite sure where we left off when we lost the sound on here, so I may be repeating some of the things I just touched on. But what we were discussing was some of the key points in which Public Safety Commission and Public Health considered, when making decisions moving forward and the current state of where we're at. We did talk about the increased risks in terms of, allowing more activities, within the community to open up back to near pre-pandemic conditions, as well as things opening up, whether it be internationally or across the province of Quebec. More activities, more contacts. People also have more of ability for us to contract the virus. So all these factors, are also important for us to be mindful of. It's not to say these activities shouldn't be done or are wrong. It's just a matter of knowing the fact that these activities do increase the level of risk, and of transmission, and more reason why we need to be cautious and vigilant. Also, the cases in the U.S. are gradually increasing, and also we know a lot of people are traveling to the U.S. So again, be cautious, be vigilant. And again, throughout Europe, what we're witnessing in Europe is what appears to be the beginning of a fifth wave in parts of Italy and Netherlands and parts of Germany. So they're also contemplating some lockdowns in Europe to try to curb the spread. Again, this is a global pandemic. We have to be mindful of what's happening around the world. And as we've seen in previous waves, what happens in Europe, 2 to 3 months later, it starts impacting, the shores of North America. Not to say that it definitely will, but we certainly got to be mindful of what's happening, because there is that probability of having that increased cases, and a fifth wave, hitting North America. Again, by being vigilant, by being safe, following measures, and having level of vaccination that would curb the spread is still the key moving forward. We also look at the impacts on local businesses. The economic recovery has not been full, but many businesses are operating at near pre-pandemic levels. So the economic recovery is on the way. And throughout the recovery phase over the next while, we're hoping that's going to continue to increase and allowing, again, businesses to operate much more efficiently, effectively, like they did prior to the pandemic starting. Socially, we also open up more activities in the community, allowing more gatherings, and further reducing restrictions, as mentioned earlier. That's also helps support the social and mental well-being of our community. We had received the support from Chief and Council regarding the extension of the state of recovery, and which was done by consensus. So the support is there for continued efforts of public safety and public health to ensure that we take action that is appropriate to curb the spread as much as we possibly can, within the community. And as I mentioned before, we always do our best to make decisions purely based upon information from public health experts and the science to guide the decisions moving forward. And we make decisions outside the scope of politics, but we understand that at times, especially at the length of a pandemic, that there are times where there is political implications to decisions that are made. But our decisions are done based upon the well-being of Kahnawà in terms of maintaining the health of our community. The schools and public health have proven to be successful in minimizing the spread of the virus and containing any outbreaks that had happened, and they do need continued support. With that said, there has been a press release this recently put out. There is currently an outbreak in a classroom bubble over at Step by Step. Step by Step is working very closely with local public health to contain that. the same way they had addressed previous issues within education facilities. So they are in the process of addressing that. All parents and impacted people have already been contacted, and Natalie Bova, the executive director of Step by Step, remains available through email to be in contact with them. And that's, if any questions or concerns that you already have not been addressed, you can email at info@stepbystep.ca, and that's step.ca, and that would somebody will get back to you regarding any of your questions. Again, these issues, obviously, we're not glad to hear about outbreaks in facilities or cases in general, but again, it just demonstrates the fact that we need to remain vigilant, we need to remain careful, and the threat from COVID-19, although has lessened, and although things are moving towards a recovery, moving towards a normalcy, we still got to be vigilant, we still got to be careful, we still got to keep our guard up over the next while. That's why, after consideration of many of these factors, which I just outlined, the decision was made that we are going to have to remain at the yellow level alert, for the coming weeks, due to many factors as I outlined, and this will be revisited, after the holiday season, to see if we are able to reconsider and look at continuing downgrading and continue that path down the state of recovery. We are generally on a good path. Again, we ought to remain cautious and we ought to remain vigilant. And again, with everybody's cooperation, we will see the end of this. On a very positive note, we're certainly Public Health and Public Safety Commission are pleased to announce that we have confirmed vaccination for the 5 to 11-year-olds for Kahnawà. We have, Public Health has secured the vaccine doses for children, and we are going to start taking appointments through the Kahnawake911.com website, which will link you to Kahnawake Memorial Hospital. You can click on Make Appointment, and there will be a link there to click Santé. And also, this information will go out in a press release very, very soon. So the vaccinations will start as early as tomorrow, November 26th, from 3 p.m. till 8 p.m., Saturday from 9 to 5, and then again next week, Tuesday, 3 to 8, Wednesday, 3:30 to 8, Friday will also be from 3 to 8, and Saturday from 9 till 5. This information will be put out very, very shortly in terms of hours, but you can start booking appointments very soon, going through that portal to Kahnawake 911, the Kahnawake Memorial Hospital site, and click for an appointment. And I just want to emphasize a couple of points on there. Obviously, consent is required by parents. No child will be vaccinated if a parent does not consent. So I want to put that out there right away. And I know in Quebec, there are vaccinations happening in schools and such. That's not going to be the case within the community. All the vaccinations are taking place at the Knights of Columbus, where we set up our vaccination center. So a parent is asked to come with their child to sign off on the consent form, and then your child will be vaccinated. So this is one more step, a very positive step for us to bring an end to this pandemic, to hopefully minimize outbreaks such as we see as step-by-step outbreaks, which we have seen at the schools in the community, and allow the young children to be with their grandparents and parents in a much safer way. So it's one more step to recovery. It's one more step to get us where we need to be, and we look forward to having some positive results in that area. So with that, thank you very much for listening, and once again, sorry for the technical difficulties, and we'll talk again soon. Onegwahi.